Aditya Dubey, please switch on your video. Aditya Dubey, 7th A, please switch on your video. Prakhar Srivastava, switch on your video. Shivam Pathak, switch on your video. Aditya Dubey, you are not listening to the teacher. Prakhar Sharan, you are also not listening. Prakhar Srivastava, switch on your video. Shivam Pathak, switch on your videos. Good morning, my dear students. Yesterday, due to the technical issues, I could not take up the class. We are sorry for that. And today, I'll be teaching you the same topic which I had to teach yesterday. So without wasting much of your time, I'll start taking up. Do you want me to teach from the beginning or from where the problem started? Okay, so yesterday the problem started from here. So I'll be taking up from this topic, that is prevention of a drug allergy. See, we take many type of medicines or drugs, okay? So some may suit us and some do not suit us. After taking some of the medicines, we start feeling uneasy, we start feeling discomfort, and the symptoms may become severe as the blood pressure may fall down. We may feel dizzy, we may feel itchy, etc. So such problems lead to anaphylaxis. Anaphylaxis is the severe stage of the allergy. So if you have a drug allergy, the best prevention is to avoid the problem drug. That means if you are having problem after taking a certain type of medicine, then stop taking that medicine. It may be in the form of spray, in the form of gel, in the form of ointments, in the form of capsules or tablets, or in the form of liquid also. If we feel that we are having any kind of problem, then we should immediately stop using that. And in adverse cases, if we are having such kind of problems, if we feel that it is mild, but it may become severe, then always you should be carrying an antidote for that. Antidote is a medicine which will subside the effect of that particular allergy. And that medicine is epinephrine. Epinephrine. Children, you must enter the class on time. Otherwise, allowing you every time becomes very difficult for the teacher to admit you. So please see that you enter on time. Avoiding dust mites. You know that dust mites are present in dust, and whichever article collects dust, dust mites will be present in that item. Be it a bed sheet, be it a blanket, a pillow, stuffed toy, mattress, etc. The dust mites are present in that because these mites live in dusty areas. So wash the bed sheets and blankets once in a week in hot water. Whichever blanket we are using or bed sheet on which we are sleeping, that should be washed in hot water, because hot water kills the dust mites as well as other microorganisms also. Choose washable stuffed toys. I had told you that you need to choose stuffed toys. Why you need to choose washable stuffed toys? Because again, the stuffed toys are the toys which absorb most of the dust. So if we carry those stuffed toys to the bed, or if we are handling those stuffed toys, then the dust will adhere to our fingers. The dust will be dusted on the bed where we are sitting or lying down, and hence it may lead to an increase in the dust mites. So we need to be wise enough to choose the stuffed toys. We should buy toys which are of use, which are washable, which could be washed easily. So yes, choose washable stuffed toys. Now cover mattresses and pillows. The mattress and the pillow that you are using should be covered. Uncovered mattress and uncovered pillows should not be used, because when we put our head over there, then the dust mites could stench on our face or on our body, thus leading to allergies. So we need to be wise enough so that we are very much out of danger. Vacuum often when asthmatic is not present. Vacuum often means जब भी हमको मौका मिलता है तो हमको क्या करना चाहिए? We should vacuum clean the house, vacuum clean the stuffed toys, because what happens? Because the vacuum sucks up the dust, and as the vacuum sucks up the dust, the item becomes dust free. But if you are asthmatic, if you are having breathing trouble, then you need not use the vacuum cleaner, as due to its exhaust pipe, the dust fumes may create problem. Maintain low indoor humidity. Maintain low indoor humidity. That means that inside the room, the humidity should be controlled. The room should not be humid, as humid conditions give rise to the breeding or reproduction of fungi. And then when the fungi grows, it creates many problems. It also creates respiratory problems, as nowadays you are hearing about the black fungi, the white fungi, the yellow fungi, etc. But this that you are hearing is all related to the COVID. But the fungus also, when the fungal spores are inhaled, they also create problem in the breathing system or in the respiratory system. So that is why the humidity should be 30 to 50% in the room, not above that, because that may lead to problem. Again, you all are entering the class, and that is creating problem for the teacher, because every time permitting you. So you should be on time so that I don't find it difficult to keep on admitting you, though I have admitted you. Okay, now environmental control. See, there is an environment around us. Everything that we see or everything that is present around us makes up an environment. So that environment should also be allergen free so that we do not face many problems. So the environment could be our bedroom or the rest of the rooms of the houses. So cover mattress and pillows with impermeable covers. Nowadays in the market, certain type of covers are available which are washable and which are impermeable. Impermeable, that means they do not allow the dust to enter into the fillings of the pillows and the mattresses. Wash bedding regularly. That doesn't mean that you have to wash your mattress. But what we have to wash our bed covers. We have to wash the thin blankets that we use, as well as the pillow covers or the bed sheets that we are using. Remove carpets, stuffed animals, and clutters from the bedroom. Whatever is not required in the bedroom should be removed from the bedroom, because you know that the waste material becomes a clutter in the bedroom. So that needs to be removed from the house, from the room also. Then carpets, thick carpets. It's a fashion of putting up thick carpets in the room. It looks good. It gives a good appearance to the room. But you know that it is the most dangerous thing when the health is concerned, because the carpet collects or absorbs most of the dust particles. It also collects the fungal spores and the dust, the disease causing germs. So hence the carpets, if we like to place them in the room, they should also be treated in the sun, or they should be also kept in the sunlight so that they become warmed up, and they should be vacuumed every week so that they are rid off from the dust and disease causing germs. And the same thing as I told earlier should be done for the stuffed toys also. Washable stuffed toys should be taken up so that you can wash them and you can use them. And every now and then you people are joining. So please say that you join on time. Please join on time. It becomes very difficult for the teacher to keep on joining you. Next, vacuum weekly, wearing a mask, using vacuum cleaner with a double thickness bag or a highly efficiency particulate bag. That is a bag, highly efficient, HEPA, highly efficient particulate air filter. This air filters are put up in the vacuum cleaner so that they can filter the air by absorbing the dust particles. And vacuum cleaning of the house should be regularly done weekly. Now, rest of the house, how will you treat them? Minimize carpets and upholstered furniture. About the carpets, I've already told you. Upholstered furniture means the furnitures which have been covered decorately by a thick covering of cloth. आप जानते हैं आजकल सोफा सेट्स में कपड़ों से सजावट की होती है, उसके ऊपर एक कपड़ा चढ़ा होता है. So that is called as upholstered furniture. Even the curtains, which are thick, they are also collecting the dust, so they need to be washed regularly. Reduce humidity below 45 degrees. Relative humidity, that is, the humidity in the room should be only 45 degrees or below that, not more than that. And for that, we need to use dehumidifiers. Dehumidifiers are devices that suck up the moisture of the room and keep the humidity level in control. Treat carpets with benzyl benzoate or tannic acid. These are the chemicals which reduce moisture and which kill the disease-causing germs as the allergens which are collected in the carpets. (130°F), or that is 55 degrees Celsius, can kill dust mites. Again, they are coming, and now I'm not going to admit anyone, as already 15 minutes are over. Yes, as already it is 10 o'clock, and I'm not going to enter anyone. So now washing beddings at 130°F. 130°F पर आपको कपड़ों को धोना चाहिए, especially the bed linen. Then most mites are killed in the washing process, or they die by drowning. See, जब हम पानी में कपड़े धोते हैं तो जो allergens हैं या disease causing germs हैं, they die off by drowning. Drowning का मतलब है डूबने से मर जाते हैं वो. So although higher temperature kills slightly more mites, और जो higher ज़्यादा टेम्परेचर हाई होता है वॉशिंग के टाइम में, तो वो भी जर्म्स को किल करता है. Then there is evidence that temperature lower than 130°F are adequate. High temperature is not necessary. Home hot water should be kept below 120°F because to prevent danger of getting burnt. Wash bedding weekly in warm water without aiming for a specific and potentially dangerous temperature. This will remove most, not all, mites and mite allergens. Clothing also should be washed after using. We all know that whatever clothes we wear, once those should be washed in a good detergent and they should be rinsed off properly to avoid any kind of detergent allergy. Now, removing carpet is more effective in the long term than any currently available carpet cleaning measure. जितने भी carpet हैं आपके कमरों में लगे हैं, उनको rainy season में especially or during the winter season, they should be removed because the winters also are quite humid. Mahika Prakash, you are talking and somebody is sitting behind you. Who is disturbing you? Mahika Prakash, please see that you sit properly in the class. Designing the house with polished floors and wooden or vinyl or leather furniture to limit the sites where mites can grow and to reduce dust collectors as to make cleaning easier. Say, the flooring should be polished. That means nowadays we are using marble flooring or tiled flooring. The tiles are polished and we should use either tiles or wooden floors or marbles or vinyl flooring so that they do not collect most of the disease causing germs, most of the allergens and the dust mites. And as a result, cleaning of these surfaces becomes more easy. Remove excessive using. Now, what to remove? Remove excessive humidity by using a dehumidifier and or air conditioner. See, dehumidifier, this device that is shown over here, this white and blue colored device, the picture one, is the dehumidifier. This dehumidifier works by blowing out warm air, and because of this, the environment becomes warm enough and the moisture that is present in the environment is reduced. Dehumidifiers need to be emptied regularly. As you can see here, this is the structure of the dehumidifier, and you can see that these dehumidifiers, they collect excess of moisture, as the blue color shows here, the water content, and it should be located in areas where dampness is likely to occur. ऐसी जगह में इसको रखते हैं जहां पर ज्यादा damp position होती है. Air conditioners need to run long enough to remove sufficient moisture of the air to decrease relative humidity. RH means relative humidity. See, when in the room there is much of moisture, even on the surfaces, on the floor, you will see that because of the moisture, water droplets appear and the flooring also becomes moist. In that case, we can use air conditioners for a longer period of time because the air conditioners also absorb moisture and they decrease the relative humidity of the environment. Vacuum weekly, as I have already told you, using a mask, using vacuum cleaner with a double thickness bag or a highly efficient particulate air filter. That also I have described. Modit Gupta, please be attentive. Regular vacuuming is essential for preventing buildup of mite allergens in homes with carpets. That's all we have discussed, and we need to keep in mind that regular vacuuming, sweeping, mopping, as well as removal of moisture with the help of dehumidifiers and prolonged use of air conditioners are the best for treating with moisture and reducing the dust mites and fungal spores. Avoiding pet triggers. Now, earlier we have studied that pet dander, that means animal hair, pet hair, and dead skin is a cause of allergy. So consider keeping pets outdoors or even finding a new home for your pets if necessary. You can make a shed out of your home for your pets so that they do not enter the house, or if they are entering the house, the floor, the room should be properly swept off, mopped, and vacuum cleaned so that the pet hair and the pet's dander could be vacuumed and removed from the room, because you know that the pet hair, it can be inhaled by us and it causes asthma. Asthma ki bimari, asthma. Keep pets out of the bedroom at all times. And you know that as we have internal parasites, pets also have internal parasites. And as they roam about everywhere, so the disease-causing germs may adhere to their paw. And when we touch those dirty paw, and when the doggy or the cat comes with the same dirty paws inside the room, they may bring disease-causing germs inside the house. And if it is not treated properly, then we are likely to catch up the diseases also, besides catching up the allergies. Keep pets away from fabric-covered furniture, carpets, and stuffed toys. Some of the pets, they are allowed to play with the stuffed toys, and they bite on the stuffed toys. They lie over the carpets. They sit on the furniture. They lie on the bed also. And people say, my dog is vaccinated. My dog is vaccinated. मेरे dog को vaccine लगा हुआ है. मेरे dog को injections लगे हुए हैं. मेरे dog से मुझे कोई बीमारी नहीं लगेगी. बट जैसे मैंने आपको बोला कि आपके अंदर जैसे इंटरनल पैरासाइट होते हैं, उसी तरह से डॉग के अंदर भी इंटरनल पैरासाइट्स होते हैं. डॉग के अंदर भी टिक्स होती हैं. टिक्स, किलनी जिसको बोलते हैं, टिक्स, वो डॉग का जुआ है. सो वो उसके लिए तो कोई इंजेक्शन नहीं दिया गया है. तो डॉग की टिक्स जो है वो आपके कारपेट में आ सकती हैं, आपके फर्नीचर्स पे, आपके बेड में आ सकती हैं, आपके स्टफ टॉयज में आ सकती हैं. जो उसके अंदर के पैरासाइट्स हैं वो इन सारी चीजों में अपना घर ढूंढ लेंगे और वो इन सब में रहने लगेंगे. और उसके बाद you know that the ticks suck blood, and then they will, if they adhere to your skin, they will suck blood from your skin also. So please keep in mind that the pets, they should be loved, they should be cared properly, but they should not be brought inside the house, and they should not be allowed to sleep or sit on our mattresses, on our furnitures, etc. Pest avoidance. Now this is not pet, it is pest. Pest जो है वो externally जो है वो crops के ऊपर में होती है, उसको हम pest बोलते हैं. जैसे कि grasshopper is a pest. Okay, so free your home of places for pests to hide and sources of food and water. Cockroaches, ये सब से हमको अपने घर को free रखना है by always spraying some of the insecticides which can kill them or which can allow them to fly away. Regular, careful cleaning the kitchen means the kitchen should be regularly and carefully cleaned. Because of the food and because of the water, the kitchen becomes a favorable place for these pests. So they need to find home inside the kitchen and will cause dirt. They will excrete over there, their feathers, their wings, etc. will fall and create nuisance in the kitchen. So they need to be cleaned. The kitchen also needs to be cleaned every day so that these pests do not stay inside the kitchen. Daily trash, daily waste should be thrown away. Store food in airtight containers so that these do not enter your food items. Extermination baits, gels should be used. Means traps should be placed in the house so that these pests are trapped and then they are removed or thrown out of the house. Precautions that should be taken when allergic food is consumed. There is no treatment to cure a food allergy, as we have also talked about this. And the best way of preventing an allergic reaction is to identify the type of food that causes the allergy and then avoid it in future. This you can only tell. Nobody else can tell that which food you are allergic to. It's you who are going to identify. If regularly after eating that food item, you feel some indifferent symptoms like stomach ache, vomiting, dizziness, or loose motions, then and regularly after consuming that food, every time you feel the same thing, then that shows you are allergic to that food. And there is no cure for that. Only thing is to avoid that food. Or when I was teaching you this food allergy, that time I told you that you have to make yourself adjacent to this. I mean, you have to adjust to that food item by consuming the food in small quantities. And if you are taking them in small quantities till a week, and after that increasing the dosage, then you may become accustomed to that food. People with a food allergy are often given a device known as an auto-injector pen. This is a device which looks like a pen, but it has a needle which can be inserted in the body, which contains dosage of adrenaline that can be used in case of emergencies. If there is an emergency situation after consuming a food, this auto-injector pen contains an dosage of adrenaline. Adrenaline is a hormone which is used to control the food allergies. Reading food labels. This is a very, very important thing, and it is very useful also, that before buying any food item, you must first read the contents of that food item as it is shown in the picture. Every food item, every packet, every can contains the description of the ingredients that are included in that particular food items. Like you can see here, the ingredients, but it is showing as buttercream, filling, etc., etc. How much sugar is added, how much protein, how much fat is added to that particular food item. And allergies, what allergies it can cause. Like if it contains egg, and people who are allergic to egg may feel symptoms after consuming that. Gluten allergy, milk allergy, nuts allergy also. It's some of the producers, they mark the allergies also on the description label. So it's very advisable that we read the labels before buying the items, and those food items should be not bought if we think that they are or they may cause allergies by consuming them. Domestic or imported packaged food should have a label that lists whether the product contains one of the top 8 allergens. That means you need to first check on whether you are buying domestic, it's Indian food item, or you are buying an imported package, but the label, the content of the food item should be read, and then only it should be bought. Now, the prevention part is over, children. And now we'll be discussing about allergy testing, how allergy test is being performed. See, allergy testing includes skin prick test or patch testing. A series of tiny punctures or pricks are made into the patient's skin. As you are seeing a child over here, and the child is clinging to his mother, and a nurse or a doctor is pricking the back portion of the child with a needle. And that those needles, different needles contain different amount of allergens. And with the help of the needle, the allergens are administered, or they are put or inserted into the skin of a person. Small amounts of suspected allergens or their extracts, example, pollen, grass, mite's protein, not mite, but the protein contents of the mite, peanuts, not the peanut itself, but the extract of the peanut, are introduced to sites on the skin marked with a pen or die. जैसे ही वो मार्क लगा देते हैं, इंसर्ट कर देते हैं, सपोज यहाँ पे इंसर्ट किया, यहाँ पे इंसर्ट किया, यहाँ पे, यहाँ पे, यहाँ पे, यहाँ पे, तो इसको ऐसे गोल मार्क कर देंगे इस तरह से. They will be marked like this and they will be labeled as A, B, C, D, and the doctor or the nurse will make note of this A, B, C, D. That A is the groundnut extract, and this is the pollen, this is the mite protein, etc., etc. Common areas for testing include the inside forearm and the back. Here also some of the tests are done, the inside of the forearm and the back portion also. If the patient is allergic to the substances, a visible inflammatory reaction will usually occur within 30 minutes. And if the patient is allergic to that particular allergen, so जैसे ही ये allergen insert किया गया शरीर के अंदर, 30 minutes के बाद ही इस जगह पर swelling सी हो जाएगी, and this swelling might increase, it keep on increasing, and this shows that the person is allergic to that particular allergen, and later on that area may become reddened also. Now patch testing. Patch tests are for delayed reactions. ये तो हो गया आपके 30 मिनट्स में आपको पता चल गया, लेकिन कुछ ऐसे एलर्जेंस होते हैं जिनको बॉडी में डालने के बाद they do not show symptoms within 30 minutes, but they show symptoms after a long time, and that is patch tests for delayed reactions. It finds the cause of skin contact allergy or contact dermatitis. Now, ये सारी चीजें contact dermatitis के लिए होता है patch test. Contact dermatitis, I have told you, if something comes in contact with the skin. Suppose you are wearing an artificial jewelry, जैसे कि ये necklace है. This necklace, it is of gold, but sometimes we wear necklaces which are artificial, which are made up of certain other metals. So वो आपको ये आपको insert नहीं किया जा सकता आपके body में. ये आपके बॉडी में कांटेक्ट लगाया जा सकता है, जो कि कुछ समय के बाद आपके बॉडी में रिएक्शंस दिखाएंगे. So they need to be contacted. So adhesive patches, usually treated with a number of common allergic chemicals or skin sensitizers, are applied to the back. इस तरीके से adhesive patches आते हैं जो उस particular एलर्जन के से बने होते हैं और उनको आपके पीठ में चिपका दिया जाता है, और थोड़े समय के बाद, एक दिन के बाद, some 72 hours also, they may show up symptoms. The skin is then examined for possibly local reaction, usually at 48 hours or later also. After application of the patch, and again 2 or 3 days later also, they may show up skin reactions like hives, like itchiness, redness, etc. Different diagnostic tests for allergy detection. Now, blood test also is another type of allergic testing. Besides prick test, besides patch test, blood test. Adults and children of any age can take an allergic blood test. Allergy blood tests are safe as the person is not exposed to any allergen during the testing procedure. आपके शरीर के अंदर किसी भी एलर्जन को इंसर्ट नहीं किया गया और ना ही उसको आपके शरीर से कांटेक्ट करा गया, बल्कि आपके शरीर से ब्लड को निकालकर और ब्लड के साथ में उसके प्रोटीन्स को टेस्ट करके पता करा गया है. इसीलिए जो प्रिक टेस्ट है, जो पैच टेस्ट है, वो रेकमेंड नहीं किया जाता है, बल्कि ब्लड टेस्ट फाइंड्स मोर कन्वीनियंट एंड मोर suitable for the patients. The test measures the concentration of specific IgE, immunoglobulin E antibodies in the blood. The higher the IgE antibody value, the greater the likelihood of symptoms. जैसे ही ब्लड टेस्टिंग में IgE एंटीबॉडी का वैल्यू ज्यादा आएगा, उसी से पता चल जाएगा कि आपको उस एलर्जन से कितना % एलर्जी है. The quantitative allergy blood results can help determine what a patient is allergic to, predict and follow the disease development, estimate the risk of a severe reaction, and explain cross-reactivity. Now, this test can determine that which allergens are you allergic to, and by this, a prediction of the disease development can be followed, and the severity of the allergy can also be estimated, as well as cross-reactivity. That means you are allergic to how many other allergens can also be determined by this blood test. Laboratory methods to measure specific IgE antibodies for allergy testing includes enzyme-linked immunoabsorbent assay. When you go for a blood test, often they give you a report on which is written ELISA test, tested by ELISA. ELISA is enzyme-linked immunoabsorbent assay test, which gives you a more defined test and a more accurate test. Radio-allergos absorbent test and fluorescent enzyme immunoassay test. These are all the tests which are performed on the blood sample, and then the allergy is confirmed. Now, how are you going to treat the allergies? You have studied that the best way is to avoid the allergen. Definitely, it is correct, but the treatment also includes medication and immunotherapy. Some allergies may require medicines, as I had given you the name epinephrine. So decongestants and antihistamines are the most common. Decongestants, आपको respiratory problem हो गई, chest में आपके congestion हो गया है और आपको सांस लेने में प्रॉब्लम हो रही है, उस समय में decongestants दिया जाता है. अगर आप कॉफ सिरप पीते हैं, कॉफ सिरप के ऊपर में लेबल लगा होता है decongestant. That means it clears the excessive fluid that has been created by any disease-causing germ or any allergen, and that will be removed in the form of cough or phlegm. मैंने आपको बताया था कि हिंदी में उसको बलगम कहते हैं, जो खांसी करते वक्त पीला पीला या हरा हरा थिक सा सब्सटेंस निकलता है, थिक स्प्यूटम जो निकलता है, उसको हम बलगम हिंदी में बोलते हैं, बट इंग्लिश में उसको बोलते हैं फ्लेम. और ये फ्लेम भी जब आप डीकंजेस्टेंट्स पीते हैं तो आपके लंग्स में से लंग्स क्लियर होके ये फ्लेम को बाहर निकालते हैं. एंटीहिस्टामिन्स यूज करते हैं ताकि आपको एलर्जिक रिएक्शन सबसाइड हो सके, कम हो सके. They help to reduce a stuffy nose, runny nose, sneezing or itching, and some of the medicines can also help to reduce a stuffy nose. कभी कभी आपको नाक क्लियर नहीं लगती है, नाक में भारीपन लगता है, ऐसे लगता है कि नाक में कुछ है, और कभी कभी नाक से पानी निकलता है, उसको रनी नोज कहते हैं. कभी आपको लगातार छींकें आती हैं, लगातार छींकें आना किसी एलर्जी के कारण भी होता है. Or itching, the body starts itching. So all these are the problems which arise due to some of the allergens. So all these can be subsided. Subsided means कम किए जा सकते हैं, or they can be removed. So there is no permanent cure for allergy. So they can only be subsided, they can only be lessened. Now, corticosteroids treat inflammation in the nose. Mostly steroids are given. Nowadays, you must be hearing that corona treatment के लिए steroids दिए जा रहे हैं. Now, corona disease cause करता है. यहाँ हम बात कर रहे हैं allergens पे, जो disease नहीं cause करते हैं, जो allergy cause करते हैं. So, जो allergens को inflammation यानी कि वहाँ पर swelling, वहाँ पर redishness होना, uneasy feeling होना, इसको दूर करने के लिए corticosteroids यूज किए जाते हैं. Next is immunotherapy, a preventive treatment for allergic reactions that involves giving gradual increased dosage of the allergens. The slow increase of the allergen allows the immune system to become less sensitive to the allergen. Now, immunotherapy में क्या करते हैं? Immunotherapy, the word immuno means something to do with your immune system. A therapy which will be given for your immune system. It is a preventive treatment and it is given for allergic reactions that involve giving gradual increased doses of the allergen. धीरे धीरे करके थोड़ा थोड़े अमाउंट में आपके बॉडी में सेम एलर्जेंस को देना, सेम एलर्जेंस के प्रोटीन एक्सट्रैक्ट को डालना. The slow increase of the allergen allows the immune system to become less sensitive to the allergen. जब आपको थोड़े थोड़े अमाउंट में एलर्जन का एक्सट्रैक्ट आपके शरीर में डाला जाता है, तो आपके बॉडी का इम्यून सिस्टम, आपकी बॉडी के जो एंटीबॉडीज हैं, वो उससे फाइट करने लगते हैं, उसको बाहर का सोल्जर समझ के उसको मारने की कोशिश करते हैं. They try to combat it. और इस तरह से धीरे धीरे जब हम डोजेज को बढ़ाते जाते हैं, तो फिर हमारे शरीर में उस एलर्जन से हमको कोई प्रॉब्लम नहीं होती है. जैसे ये उसी तरीके का ट्रीटमेंट है जैसे वैक्सीनेशन. वैक्सीनेशन में भी हम किसी भी माइक्रो ऑर्गेनिजम्स का या वायरस का एक बहुत छोटा अमाउंट, एक वीक जर्म या एक किल्ड जर्म इंसर्ट करते हैं बॉडी के अंदर, और बॉडी का इम्यून सिस्टम, बॉडी के अंदर जो एंटीबॉडीज हैं, which are called the soldiers of the body, they start fighting. They recognize it कि ये बाहर का घुसपैठिया है, इसको हमको किल करना है, इसको हमको मारना है, तो वो क्या करते हैं और ढेर सारे एंटीबॉडीज को बना लेते हैं, ज्यादा से सोल्जर्स बन जाते हैं शरीर के अंदर और फिर वो उसको मार देते हैं. लेकिन आपके बॉडी के इम्यून सिस्टम ने, आपके बॉडी की एंटीबॉडीज ने अब उसको पहचान लिया है. यदि फिर से वो बाहर से आया तो वो लोग ज्यादा ताकत के संग उससे लड़ सकेंगे. इसीलिए आजकल आप लोगों को कहा जा रहा है वैक्सीन लीजिए, वैक्सीन लीजिए. वैक्सीनेशन इज अ प्रोसेस of building our immune system. It is not a cure. It is not 100% cure system, but it will only boost up. It will only increase the immunity of your body, and hence your body will be able to fight any kind of allergen. Now, several medications can be used. These are antihistamines, glucocorticoids, epinephrine, which is also called as adrenaline, mast cell stabilizers, anti-leukotriene agents, anticholinergics, decongestants to impair eosinophil chemotaxis, antibiotics such as penicillin and its derivatives can be used to treat bacterial allergies. So these are the names of some of the medicines that are used for the treatment of allergies. Shruti Mohan, 7th A, your video is not switched off. So something seriously has to be done. If we are taking up an online class, that means you have to be present live on that. not with your profile pictures or not with a darkened environment. Shruti Mohan. Natural allergy treatment. There are certain natural allergy treatments, children, and these allergy treatments are getting tested in easy, and you might already know what you are allergic to. Means आप अपने आप से बॉडी में टेस्ट कीजिए कि आप किस चीज से एलर्जिक हैं. You are allergic to what food, and then either you start avoiding it or you start taking immunotherapy. Means by taking small dosages of that allergen. One day you take only 1 spoon, the other day again 1 spoon, till you feel that the body is able to adjust with that. With natural allergy treatments, anyone can alleviate bothersome seasonal allergies. The process involves exposing the body to the substance that causes the allergic reactions steadily and in increasing doses over time, creating a tolerance and reducing the allergy. This process involves exposing the body to the substance that causes the allergic reaction. Means आपको अपने body को either if it is a food allergy तो आप उसको small amount में खा के भी ऐसा कर सकते हैं, और अगर वो दूसरे टाइप का एलर्जन है तो अपने बॉडी को एक्सपोज आप करेंगे और वो एलर्जन जो है वो आपकी बॉडी में used to accumulate steadily and in increasing doses over time, creating a tolerance and reducing allergy. आदित्यनाथ, बहुत खुश हैं आप 7 से. जिस समय मैं टेस्ट लूंगी उस समय मैं आपको बताऊंगी कि आप खुश होंगे कि मैं. ठीक है ना? So that's all for today, and I have come to the end of this chapter. So from the next chapter, next topic, that is lesson 4 will be taught to you. Lesson 4 is human body. Lesson 4 will deal about the excretory system and the nervous system. So I will be taking up excretory system first. Whatever homework has been uploaded, please do that homework. And please be up to date with the work that is given to you. Every day you should watch for the work that is given to you. Okay? So bye-bye, children. Have a nice day.